So I would like to answer the question whether masks offer substantial protection or not. In order to answer this question, we need to understand a few words. Number one, substantial exposure. Number two, nominal exposure. Number one. Number three, the possibility of the infected person, whether symptomatic or asymptomatic, transmitting the disease. Number four, the unaffected person contacting the disease. We have to view this problem from these four angles. Now, initially there was a discussion that only the N95 masks are effective because the pore size of cloth masks are too big and the viruses can easily go through it. And now, the government of India yesterday, the Ministry of Health exactly, announced that N95 mask could be a risk factor because the outflow of air through the N95 vents would be a source of contamination. If the person wearing the mask is affected, his exhaled air could be a source of contamination, and it could go through the N95 outlet valves. Now, what exactly is the case? Please note, today many research organizations suspect aerial transmission, and micro droplet transmission is almost confirmed. Both air and micro droplets can easily go through or penetrate through the pore size of cloth masks. The N95 masks would be equally ineffective if there is air transfer. See, if a person is inhaling and exhaling, through the exhaled air, the virus can easily come out either through the air or through micro droplets, and this could infect others. So then what is the point of wearing masks? There definitely is a point of wearing masks. The point is the difference between nominal exposure and substantial exposure. Many of us are immune to even substantial exposure. Means, even if a person coughs right in front of you and discharges droplets on your face, if you have a very strong immunity, nothing is going to happen. But most people are on the borderline with immunity which is not very strong, immunity which is somewhat okay, might get infected when there is a substantial exposure. So what happens is, masks actually protect people from substantial exposure. It doesn't protect people from nominal exposure. Whatever be the mask, whoever be the person, nominal exposure will definitely be there, either through aerial transmission or through micro droplet transmission. But then, nominal exposure may not affect most people with a strong immunity. Even substantial exposure may not affect people with very strong immunity. So the point here is, we must wear masks, towels, whatever is available to prevent substantial exposure and to protect more people with immunity which is not too strong from a substantial exposure. I hope this point is clear. The point is this: none of the masks, whether N95, with or without valves and exhausts. Whether it's a cloth mask, towel, whatever, 3-layer mask, whatever, cannot prevent nominal exposure. It can only prevent substantial exposure. But nominal exposure may not affect most people, whereas substantial exposure may affect more people. So we must definitely insist on wearing masks to prevent substantial exposure. And no mask, whatever be it, can prevent nominal exposure. This is the fact of the case. Thank you very much.